My name's Paula Gardner and I'm Chief Nurse at Sandwell in West Birmingham. So it's year of the midwife and nurse. I feel like I'm an honorary midwife. I didn't train as a midwife, but I feel I've picked up an awful lot of information from my Director of Midwifery, who I've worked with previously. The midwives here are amazing. They have a lot to deal with, and it's an emotional topic at times, isn't it? The birth of a child. So they do an amazing job, as equally the nurses. And here they work incredibly hard, given some of our population and how people are trying to deal with long-term conditions, etc. I'm incredibly proud of them all. I'm incredibly proud to be Chief Nurse at Sandwell in West Birmingham. With the advent of Middle and Met, that is going to be amazing for the staff and for our local population. So if you think back to 37 years ago, we used to have mercury thermometers. There are mercury thermometers still around today, but we've moved in different ways. You can take the temperature of a patient in their ear, or you can scan it on at their temple of the head. So you imagine innovation moves forward, and obviously mercury is seen as a bit of an issue as a component. And I remember one of the staff nurses, when I was training to be a nurse, dropped 35 mercury thermometers on the floor and mercury went everywhere. And years ago we just swept it up. You wouldn't be able to do that today because you've got likes of Kosh. So again, it's amazing how things do shift. For me, the care and attention that we give a patient hasn't shifted. I could still bed bath a patient, and how you bed bath a patient is how you keep them warm when you're washing them, and how then the actual sense of achievement when you've put them in clean pyjamas and combed their hair, cleaned their teeth and made them feel better for just having a wash. Just the simplest of things that help a patient feel better, and how that is then received by their relatives that come in and say, they do look better because they've been cared for. What obviously the biggest highlight for me was qualifying. That is a big thing when you qualify. We wore blue and white check uniforms as a student nurse, and I went into a blue with white piping staff nurse, a uniform with obviously the buckle I've still got here, and also a hat. I think that when I became a sister at the age of 24 was a big accolade in those days. It took a long time to become a senior sister, but I did it sort of 3 years after qualifying, which was amazing. I stayed there as a senior sister for 12 years, which I think has grounded me in when people think I don't know about what it's like to be a sister on a ward. I do. I was also a matron and also a group director of nursing and a deputy chief nurse and a chief nurse. So I've been through every iteration of what it's like to be a nurse in different areas and at different times of my life. That enables me to relate to nurses today. I think it's important they know I have done all of the elements of what it takes to be a nurse. I think my biggest pinnacle in my career, and I always wanted to be, was a chief nurse. So it is wonderful to be chief nurse at Sandwell in West Birmingham, an integrated organisation that we do care for patients literally in and out of the hospital walls. Year of the midwife, nurse, nurse, midwife, however which way we want to phrase it, is vital for us to be recognised as a profession, for people who are not in the profession, who are in other professions, to realise actually it's a massive important role that we play, but working with other professions, so our medical colleagues, our allied health staff, our portering staff, all of the other professions that help make a patient journey and experience where it should be, which is absolutely second to none. So it's great that we're being recognised as a profession, but how that links with other professions is also vital.